Hi, everyone. This is Chris Pistorius again with the Dental and Orthodontic Marketing Podcast. Here for another great episode this week. Today, we've got Eric Vickery of Vickery Coaching. Eric has worked with over 250 dental practices throughout the country and just coaching, helping out with a multitude of things. But one of his specialties is case acceptance. And so, once you present a need to the patient on what your recommendations are in terms of what type of service and treatment they should get, how do we get more of those people to say yes and come back for that? So, Eric, thanks so much for being on the show today.
Oh, it's great, Chris. I'm so thankful that I get to be on here and talk to you about case acceptance. This is great.
Right. Yeah, well, I know it's a big need in the market. We have clients all the time. Our job as a marketing company is to bring in new patients, new cases for our clients. And then, kind of once we bring them in there's some things that we can do to help. But, it's always kind of that next step. Okay, we've got them in there. We recommend treatment. How do we get more of those people to kind of raise their hand and say, yeah, let's go for that? That's something that you specialize in, right?
Yeah, it's funny that you say raise your hand. I do a 2-day seminar on case acceptance. And at the beginning, I'll say, all right, raise your hand. Who likes to sell? Who likes selling dentistry? And there'll be 1 or 2 administrative people in the room that will raise their hand.
Yeah.
And by the end of the 2 days, I do that same thing again, and they raise their hand. And here's the thing. Selling is a bad word. It's an S word, right? Sell. It's a 4-letter S word. And we can disguise it however we want in dentistry. We can call it case acceptance, case presentation, what have you. But at the end of the day, we're exchanging information to the patient. They're buying something from us. We're exchanging a service for financial profit. And hopefully we're doing it in a profitable way. And so what we don't like about the S word sell is that people feel pressured. They feel like, oh, I don't want to be someone who's a pressure salesman. They don't want to get into that mode. And so what I train offices on for the last 20 years is how to sell in a way that there's no pressure. In fact, we call it mutual agreement. They feel like they got good advice from somebody they trust. And, closing has this negative connotation to it, just pressure. And understanding how to do that in a way that is comfortable for you as the dental team member, the doctor, or for the patient. Nobody in either side of that feels like they're being pressured into something. In fact, to me, this is what pressure sales sounds like. And I hear this all the time. Quote, you need a crown. Go up front and see Jenny and she'll get you scheduled. Have any questions for me? Nope. All right, you're all set. We'll see you for your next visit. And that's it. And to me, that is telling someone what they need to do. Right. And when you're pushing and you're telling someone, that'd be like you saying, hey, you need to upgrade your website. No, I don't. I have one, right? So you don't ever approach someone that way. You approach someone with some real basis. And we want to transition from telling people what they need to providing them with something that they want.
Right.
And they're not there on accident. We just need to do more investigating and work on our soft skills to figure out what it is that's really driving them, their butt sitting in your seat right now. So
yeah, I totally agree. And I tell dentists all the time that you're not selling dental services, right? You're not selling dental products. You're really selling, and it is selling. You're right. You're selling, a solution to a problem.
That's right.
Tooth pain. You don't like how your teeth look, whatever it may be. Yep. You're trying to get somebody to that place where they want to be, right? Whether it's out of pain or a beautiful smile, whatever it is.
Yep.
And if we can focus on marketing that checks a lot of the boxes. And, it's all about, I think, selling the value. You know what I mean?
Yep.
What are some tips and some things that you teach to teams about this?
Yeah. So there's 2 rules in sales that I abide in. And the first one is people buy for their reasons, not your reasons. So you can have all the initials after your name. You could be DDS, DMD, MAGD, AACD, whatever you want. They don't know what any of that means, right? At the end of the day, they're going to be making this decision. And again, back to not pressuring them. So if you can discover what their reasons are, so I'll talk about that in a moment. And number 2, people don't buy a solution to a problem they don't perceive to have. Right. So if I live on a dirt floor and the door-to-door salesman comes to my door with a vacuum, I'm not buying a vacuum cleaner because I'm comfortable walking around barefoot on my dirt floor. But all of a sudden he shows me his vacuum and he shows me what's on the dirt floor. There's beautiful wood floors under there. Oh, wow. I didn't even realize that was an issue. I wasn't feeling any pain. And so I'll use it all the time where I say no pain, no problem, no pay. The patient's perception is no pain, no problem. Therefore, I'm not going to pay. And that's why ask your admin team member if they can finish this sentence. They make the call out for the courtesy call 2 days before their crown appointment. And the patient says, oh, I'm so glad you called me. I was just getting ready to call you. You know what? That tooth's not even bothering me, so I'm going to go ahead and wait. I guarantee you your administrative person has heard that before. Yeah. If so, that means they don't understand the problem, the condition, what's going on. And there's something chairside that we can do to fix that. All of this stems from these two rules that I abide in. It stems from want versus need. And most purchases we make in our lives fall into either one of those categories. I need to go get gasoline for my car. I need to go buy groceries. I need to pay the bills. I need a new dishwasher. I need a new fill in the blank. Those are things that life thrusts on you in a need for. It's called push. It's like it's pushed onto you. It's a need. Okay. Most people would rather be in the pull category, the want. I want to go on vacation. I want to go out to eat. I want to go to dinner. Most people don't wake up in the morning and go, oh, I really want a new crown today. You know what? I'm going to give Dr. Smith a call and get that scheduled, right? So what we have to figure out is what do they want? And you mentioned it. They want, so you do, back to number one, people buy for their reasons, not your reasons. So you would do an interview with them, a tool that I use, and you would ask the right questions. You'd set it up properly before you ever look in their mouth, and you'd find out what it is they are looking for, what they like, what they don't like, what they're looking for. And then the kicker is to find out why they're looking for that. What's important about that to them. And you'll hear things like, my son's getting married in a month and I want to whiten my teeth. I don't like my smile. There's going to be wedding photos, whatever it is. You're going to hear potential job promotion, but I don't smile enough at work. I keep getting overlooked. That was one we heard from an MBNA employee back east. We've had a grandpa brown tooth before. There's just people who have this attached emotion to a justification. People buy with emotion, justify with logic, right? So there's something there that's driving them to you, and they may not verbalize it up front, may or may not, but a lot of dentists or team members get confused. They say, oh, this person really wants to brighten their smile or change their smile or fix this. Well, that's a what they want, but that's not the driving force behind that to decide why they want that. So we'll use this question, Chris, why is having that so important to you? And you discover that, you know what, your grandpa lost his teeth and you don't want to end up like that.
Right.
And so everything that we diagnose clinically now becomes in relationship to that. It's the center of the table setting at Thanksgiving dinner, and everything has to match to that. It points to that main thing, the main dish. And so if we find something you were unaware of, gum disease, fractured teeth, whatever that might be, we're relating that back to how that connects to losing your teeth like grandpa probably did, or how that could affect the photographs or whatever. So for, 14 years and longer, I've been doing this 20 years, but about 14 years ago, I started to really perfect the verbiage of how you represent this to the patient in a case presentation formula. And I train it and teach it all over, but it takes the summation of what they said they wanted and why, right? So let's use this example. I don't want to lose my teeth like grandpa did, okay? Then we take our diagnosis that they fully understand, eliminate all of the technical jargon, and we put those two things together, and it goes like this. I say, Chris, earlier you shared with me it was really important for you to have peace of mind knowing that you weren't going to lose teeth like other family members have, right? And keeping that in mind through the exam, I'm concerned about the infection in your gums, the decay, the cavities, and how those things cause people to lose their teeth. And so how concerned are you with that? And you get that test of buy-in right there to see, did they really buy in for their own reasons? Did they solve both those two rules? Did they buy the problem, and did they buy it for their reasons? And when you make that connection, it's like when the patient asks you, oh my gosh, I didn't realize it was so bad. What do I got to do to fix it? And that's a very small percentage of time that question gets asked by the patient. Usually you hear things like, don't find anything today, doc, when you walk in the room. And so this is a way to get the patient to get to the want side of it. You told me this was really important for you. Here's something standing in the way. How concerned are you this? Yes. Okay, great. Would it make sense? Do you want to talk about a plan on how we can take care of this? And when you say, yeah, I want to talk about a plan, then you finally have the right, you've earned the right to now talk about treatment.
Right.
Before that, I never talked about Zoom or implants or crown and bridge, anything. It's all been condition and emotion focused. And then they're saying, yeah, what do I do to fix it? Now you get to talk about treatment plan. I still never say need. Need is a 4-letter word. But at the end, then we would talk about mutual agreement and close. So that's kind of a big overview. It's a lot of information at once, but does that make sense?
Yeah, absolutely. It's like the old, when I first got in professional sales or in my career a long time ago, they taught us it was kind of like the feature, function, benefit tie down.
Yeah.
And it all came from the original consultative sales approach where you ask, still today, when I bring on new clients, it's, that first meeting is all about them. I want to find out what sparked the call, why they think that they need help marketing. What do they think they need help marketing in? And when they start telling me those things, that builds a story, right? Okay. Well, 3 more patients a month would mean that the doctor and his family can spend, 6 more days together on vacation a year, right?
There's a benefit. Yep.
Absolutely. And then, so once you have that approach, you present it as, 3 more cases a month and you're on the beach an extra week with your family. What would that do for not only your bottom line, but your quality of life, right?
That's right.
And if you can build a story and refer back to that, it's amazing.
It's the anchor.
Yeah, absolutely. And I can tell you there's a low percentage of dentists that are doing that today, I believe. Just because in dental school, they do a great job of teaching these folks how to be dentists, but so little about business and marketing and selling and things like that, right?
Yep.
Which leads me to my next question. When you go in and you help somebody and you take on a new practice, are you training the entire staff, just the dentist, just the hygienist, or what does that look like?
Well, so the phone call is a great second impression, and you know that from what you do because they're already seen the website. They've already been referred by someone. So I believe that case acceptance starts with the second impression, which is how you answer that phone. And unfortunately, you know this as well, almost 2/3 of dental offices don't ask for the appointment.
Right.
They're helpers. They problem solve, and they're just there to help people. And they don't take the time to really ask, would you like to go ahead and get that scheduled?
Right.
So from the phone call, I'll say this to team members all the time. I say, all right, you're asking questions on the phone. That's great. What's the most important question you ask? And you have to earn the right to get there. That's right. But it's their name. I hear their name, the marketing source, the website, primary issue, how long it's been, all of these things. And then I'll keep waiting. Those are all good questions. What other questions? Finally, I'll say, all right, what's the goal of every new patient phone call? And they'll say, well, to schedule them. Okay, so now therefore the most important question is the last question. Would it make sense to go ahead and get you an appointment scheduled with our office, right? And so getting the team's whole psyche on board with case acceptance, and then how we then prepare the clinical team for that patient's arrival at morning huddle, so that the doctor doesn't walk in the room or the hygienist or the assistant and go, so what brings you in today? I mean, that's shooting ourselves in the foot. We just built all this rapport on the phone, and then we just drop it.
No idea why they're there.
Yeah, we walk in and say, oh, Chris, it's great to meet you. I heard a lot about you from Jenny. I know you talked to her on the phone. She told me that. And you replay those things. All the gurus that you and I probably both listen to talk about credibility. If you don't have credibility, they're not doing business with you. They're not conscious of it necessarily, but there are things that either create confidence in your competence or that it decreases confidence in your competence. Seating them on time versus late or early. Were you interrupted and put on hold a bunch on the phone? Did you walk in the room and say, so what brings you in today? And he calls you like, I don't know, Carl or something instead of Chris. And it's like, are we on the right page? Do we really know what we're doing? And this is what creates that credibility. Every interaction is creating confidence in your competence. So you have to have all of the soft skills, the system set up. You mentioned dental school and preparing them. Dental school prepares dentists this way. where does your success come from? 15% is your foundation. That is your clinical expertise. You're constantly doing clinical CE, but it literally is only 15% of your success. If you stood out front of your office with a sign that says, I'm a great dentist, come see me, it's not going to carry any weight. People got to talk about you. You have to have bedside manner. You have to have these skills. So 85%, this is from Mellon University, right? Carnegie and all those guys, right? 85% comes from your people skills and your systems and how you do this. And so I focus on training the whole team, the entire team, on how to get case acceptance, from the phone call to the doctor walking in the room to transferring that patient back to a clinical team member who then transfers that person back out to the front, to financial arrangements, to scheduling. And it's a process. And it's a team. If everybody's not on the same page, you'll get tripped up pretty easily. Yeah.
Yeah. It's important. You can get as many new patients as you want, but if we're not getting them in for the treatments that you recommend, it doesn't really matter a whole lot, right?
So, yeah, exactly. They tell me they saw 50 new patients, and I just want to know, well, how many of them have a future appointment? And you bring up a great point. I'll ask doctors all the time. I'll say, well, what is the goal for case acceptance? And they'll go, 80, 85%. Well, 85% of what? What does that mean?
Right.
And it's really specific. So we use a case presentation tracker, case acceptance tracker, and it'll track existing and new patients, their name, the type of procedure, the dollar amount, and then if they scheduled or not, and if so, how much of that dollar amount. And if there's nothing scheduled, there's a follow-up column. And we're looking at three things. One is 80% of the people are scheduling something. Okay? So you would think, 100% of people scheduling something. That's not going to happen. We're being realistic with this. 80% of the people are scheduling something. That could be a cleaning down the line, okay? Could be supervised neglect. I don't know. What would define what that is, right? Something's in the future. We need to maintain relationship with this person. But 60% of the dollars are being scheduled at the time of presentation. And a lot of doctors would be shocked to see how low that number is when they actually track it. So I love KPIs, I love advanced tracking, and I love good old-fashioned hand counting and looking at it and getting the team involved and owning that and being a part of the culture. If you were to hire a hygienist, you're interviewing two hygienists, and you say, all right, so I want the one that has 100% case acceptance or the one that has 50% case acceptance.
Right.
Part of us goes, well, I think 100%, but it must be a trick question, right?
Yeah.
It's 100% of what?
Yeah. And it's the old adage, what is it? What gets measured gets done, right?
That's right. What you measure, you improve.
Absolutely. Because I talk about it all the time. I'm like, all right, so one of the things that we do are reactivation campaigns. Maybe a patient hasn't been in 9 months, right?
Yep.
That's off a red flag in some system somewhere. It gets to us, and we take them through a marketing process to try to get them back in. So one of the initial questions is, all right, what percentage of your patients are inactive versus?
That's right.
And that's a pretty easy number to find if you you have a system. And a lot of times I get kind of the glossy eye, like, oh, I don't know, right?
Yeah.
And I'm like,
nobody wants to touch that.
You got, as any business owner, and this applies for dentist, auto repair guy, whatever it may be, you got to know your numbers, right?
Yeah.
And when you know your numbers, that makes running your business that much easier. Would you agree with that?
Absolutely. In fact, the dentists I find that are most successful know their numbers.
Yeah.
Because here's what happens. It's not just, this will get really deep now, Chris, it's not just about what I'm getting from case acceptance and dollars coming in. That means patient. By the way, I'm not a money hungry, type of coach. I know that when the dollars hit a certain number, patients are getting healthier faster. That's what this is about. The good news is we're selling health, but it's not just about what's coming in. It's also about what's going out. And so the most successful doctors are really paying attention to both. They know how to balance both. They know how to reward their team the best. They're not having turnover. They know how to appreciate. There's intangible and tangible things that we do with those numbers. And if you look at a number and you go, wow, my production per patient in hygiene is, it's 140. Ooh, what does that mean, Eric? I can look at perio percentage. I can look at production per hour and say, there's open time versus production per patient. We compare all those things. And then we say, here's how you turn that dial up. Here's how you can fix that with an actual verbal skill and system to fix your periodontal percentage that's at 20% or lower. We want it at 35% or higher. So, and there's exceptions to that, but for the industry standard, we know where we ought to be. And with tracking, we can actually coach from a position of numbers, and the doctors love it and the team loves it. It's not like, oh, more money, 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 money. It's not like that. It's like we're being as efficient and effective as we possibly can by understanding what these numbers mean and getting not somebody just going, oh, that number's low, go fix it, but having somebody who says, this is how you fix that number.
Right.
Yeah. Yeah. I
Totally
love
makes
tracking.
sense. It's like in marketing, when we first start working with people, we're like, okay, what's working best for you now, marketing wise? And it's just like, I don't know. They're just kind of throwing money and stuff up against a wall and hoping something sticks, right?
Yeah.
Versus having an actual plan in place. We're like, all right, we're going to track everything. We're going to know where it's coming from, and then budget according to that. So
yes,
now, I know you do a lot with case acceptance, but we were talking a little bit offline too about your work with insurance as well. Could you maybe expand on that a little bit and how you can help practices in that role?
Yeah. So my father-in-law is a dentist, and that's how I got my start. That's how I got here. And I managed his practice for 6 years. And we dropped Delta Dental in that time. And we used a consultant and a coach to do that. And I learned through helping clients over the last 20 years how to do that in a way that is actually better for the practice. When you're getting a 42% write-off rate, I was doing a fee analysis with a client in New York, and she was showing me it was anywhere from 40% to 53% write-off rate. Well, when your profitability is, depending on how long you've been a dentist and how much debt you've paid off, is somewhere between 25 and 40%, you're actually paying that patient to come in. If you're going to provide high quality dentistry, an hour-long hygiene appointment, and spending time with these patients. And so insurance participation was built around group clinical setting procedures and process and speed. When you're a high quality dentist, you're not built in those same regards. Right. So, in my client load, I'm probably helping somewhere between 6 and a dozen clients at a time take 6 months to drop an insurance plan from any participation all the way to Delta. And that's hard to do. So you have to have really good insulators in place to make sure all your systems are in place. You have new patient flow from the right source for the right dollar. Right. All of these things play a role. And not only that, but how you say it to the patient over that 6-month process. You're not going to, please, if you're listening to this, do never send a letter to your patient base and saying you're out of network with something. You'll never see them, okay?
Right.
Do it right. Have a one-on-one conversation with them the right way. And I just take teams through that. Hygienists become a huge player in that game because they're doing this conversation chairside, and hygienists will go, well, I don't know anything about insurance. I don't want to talk about insurance. And it's not about that. It's about relationship and connection and quality. And who do they have the best relationship in the practice? A lot of times it's the hygienist. And it's also, we know where we're seeing them every 6 months. And so we actually track, there's another tracker, we track all the names in that insurance plan. And you export that out of your software and you go, all right, we've talked with Ricky Bobby, we've talked with Betty White, we've talked with all of these people. And what was their reaction to that conversation? Was it positive or was it negative? And at the end of the 6 months, we can look at it and say, all right, we've got a great result in that conversation. Everybody was really positive. All the people scheduled their next 6-month hygiene visit. Let's go ahead and let the insurance company know we're going to move out of network. And the key thing is to know this, Chris, whatever percentage your write-off is with that plan. So let's say it's really conservative. Let's say it's 20% write-off, okay? That means you can handle losing 20% of that patient base of that insurance plan and still be at least a break even. And it's probably better than that. Right. You will see fewer patients making 20%, more on the 80% who stay.
Right.
Math always works. So I have a client that dropped 6 plans at once, which was big. Wow. Right. I usually try to deal with about 15 to 20% of the patient population at a time. So I have a tracker that we put together and it says, all right, you have 1,500 patients. In Aetna, you have this percentage. In Cigna, you have this percentage. And we add up a couple groups. We get to about 15%. And we say, all right, we're going to handle those 3 for 6 months. Then we're going to handle the next 15% of the population the next 6 months. And it starts to help that way I'm not having this conversation every single patient all day long. And we're not changing everything at once. It's a slow roll. And it works beautifully. I love this system that I've created, and it just works well with practices. I've never had I've had one client I take that back. I've had one client in Nebraska go back into Blue Cross Blue Shield because Lincoln, Nebraska is like the hub. And it's so many patients. And it's amazing how it works. And the doctor realizes, wow, there's so much more money left at the end of my month now to pay my team more, to reinvest in my practice, to invest in myself in CE, to do that extra vacation you're talking about, whatever it is, a team event. So and not feel so strapped.
just eliminating some of the stress with, trying to bill insurances and, just keep all of that stuff straight. Wow. So basically what you're saying is somebody could hire you to increase their case acceptance rates and decrease their dependency on in-network insurance. Is that about right?
That's that. You could have said,
where do you sign up?
yeah, it's definitely doable, but you got to have all the insulators in place to do those things. Meaning I need to see the numbers. I need to see what you're doing now. And I might look at it and say, I have clients who are in network with insurance and it's working beautifully because we've created systems around that process to make it work.
Right.
So it's not for everybody. It depends on where you live. I have a client in San Francisco. It's a different game. You gotta, and so a lot of young dentists come out of school thinking, oh, I'm just going to sign up for every plan. I'm going to get in network with everything. And then later on, if I want to, I'll drop it. They don't really understand the depth and the deal they're making right there. They're deal with the devil right there.
And devil, that's right.
That's right. So it's big. And so if I could first say, if you're young and listening to this, I'm happy for free to talk to you if you're right out of school and tell you, please don't sign up for every plan.
Right.
Take a slower time to get patients who pay you the full cost. You have so many expenses from an overhead standpoint. You need to be getting 100 pennies on the dollar, not 60, not 50. So No, but I'm happy to help. They can reach out to me. I love helping people be able to reach more patients and help more people. So
Well, let's talk about that, Eric. I take you taking the time to be here. I know how busy you are, but I know you live in California, right? But you work with practices all over the country and in other countries too, right?
Yeah. So because my father-in-law's in Maine, I actually lived in Maine for 6 years. So I have a lot of East Coast clientele, but I now live in California where I grew up. My family now lives here. And so I have clients in Alaska. I once had a client in Newfoundland. I work with clients in Canada. I've been, all over traveling, a lot more Zoom nowadays than traveling, but it works great. And it keeps costs down for clients. And so it's found a win-win in this too. But I'm all over the place.
Yeah. So what can you offer, maybe somebody that's listening to this or watching this, what can you, what's the first step? How do they reach out to you? Do you do a free consultation of any sort? Or
if they've listened to this and they like what they heard, they can just mention it. And I'm happy to give out my phone number. You can just text me. That's a quick way.
Cool.
You can text me there. If you'd rather, you can email me either way. But you can go to my website, vickerydentalconsulting.com. You can go there. You can text me at my phone or email me, either one.
Awesome. Do you want to give your phone out or?
Yeah, sure. Yeah, the phone number is 530-356-4011. For all the East Coast clients, just remember I'm on the West Coast when you text me. 8 a.m. your time is 5 a.m. mine. So 530-356-4011. Or you can email me. You can email me through the website, ericyourcoach@charter.net. I'm happy to help answer any questions you have. It's what I do. I love what I do. So
Nice. Well, Eric, thanks so much, man. This has been incredibly helpful to me just to learn more about it. But I can't imagine how helpful and valuable this is to somebody maybe just starting out, or maybe it's been somebody that's been in business for 20 years and is kind of tired of the insurance game and is kind of tired of losing patients that are hard enough by themselves to get in the door and not accepting the cases. So thanks so much for taking the time to be with us today.
No, thank you. It's been a blessing. Appreciate it.
Awesome. And everybody, thanks for tuning into another episode of the Dental and Orthodontic Marketing Podcast. Be sure to check in next week as we'll have another awesome guest that will help you grow your practice. Thanks, and we'll talk to you soon.